would like to convey to you all participating in this meeting my heartfelt welcome, and I want to express my sincere appreciation to the Honorable Dr. Godwin Alois Mole for allowing me to represent him to officiate this important meeting on his behalf. Kwa kweli Mheshimiwa Naibu Waziri anawasalimia sana. Ilikuwa yeye aje, sa majukumu yamegongana, kwa hiyo tunagawana kazi. Kwa hiyo muone kwamba ni yeye ndio anaongea hapa. Anawasalimu sana. Also, I would like to thank the organizers for inviting me to this event, and I'm delighted to speak to you this evening. My role, as my sister has said, is to officiate this stakeholders capacity building training, which is starting today. But before I do that, let me start briefly remark on COVID-19 situation, which has now become a global concern. Ladies and gentlemen, we are heading toward the third year of the COVID-19 pandemic, which has disrupted life and livelihood across the planet and had led to at least 5.5 million deaths around the world. Na hapa kwetu Tanzania, toka kisikia corona, yani mimi ndo nilianza nayo nikiwa mganga mkuu mkoa wa Mtwara. Nilipotoka Mtwara nilienda Arusha. Kwa hiyo ule mgonjwa wa kwanza basi sisi ndo tulianza naye tarehe 16 mwezi Machi 2020. Kwa mpaka tunavyoongea saa hizi tumesha kuwa na cases, yani visa 33,968, lakini na vifo 803, ambao mkiangalia ile athari ya ugonjwa ni case fatality rate 200.4. Lakini tukichukua vipimo vyote vya maabara kwa kutumia kipimo cha kisasa cha rapid test, polymerase chain reaction and PCR, tumeshafanya vipimo 519,175. But what is COVID-19? It is a viral disease. I think everybody knows, because we have been affected in one way or another, and it is caused by SARS-CoV-2. And as the first case was reported on 30th December in 2019 in Hubei province, China. It was declared as a public health emergency of international concern on 30th January 2020, and as a global pandemic by WHO on March 11, 2020. Hatua ambazo chukuliwa na serikali, it was key response core capacities was to apply the control to control the pandemic, which included screening of all incoming travelers and some outgoing travelers according to the destination countries at the airport, harbors, and ground crossing. Also, we developed several travel advisory, and today we were implementing, or the current one is 10th, which is still in use. So, upon discovery of the antigen rapid test, which was way back February 2021 last year, the rapid test was being done for incoming travelers, and the aim was to avoid the new variant importation. It was like a part of surveillance. And the country also responded promptly to the disease control, including isolating the contact. Nikisema contact, si tunaelewana wale ambao walikuwa karibu na mgonjwa tulikuwa tunawaweka kwa siku 14, and the aim was to avoid community transmission. And each region had isolation houses or hotels for contact isolation and monitoring. But upon the community spread of the disease, the general isolation of suspect stopped. Tukaacha baada kwenda imeshaenda kwenye jamii kuanza kufuatilia sasa utaweka wangapi? Kwa hiyo sasa target tukabakisha kwa wale wanaoingia, na lengo letu wasiletee kirusi kipya. But also hapa lazima tuwashukuru sana waandishi wa habari, tusaidia sana kupeleka taarifa katika jamii kuhusiana na mlipuko wa ugonjwa huu, lakini na njia gani jamii au wananchi wachukue, ikiwepo usafi binafsi, kunawa mikono. By that time ilikuwa ndo njia pekee, njia muhimu sana ya kuzuia maambukizi, na kunawa maji tiririka kwa sabuni, sanitizers ziko hapo, lakini kwamba kuondosha au kuzuia mikusanyiko ambayo sio ya lazima, lakini na swala la uvaaji wa maski katika maeneo yote. Na mliona kwa kweli, ongeleni sana waandishi wa habari, na washukuru sana, na kwa Arusha kweli kule mlisaidia sana kipindi kile. Lakini pamoja na hayo yote, ilikuwa kwenye watumishi kuwajengea uwezo, capacity building to healthcare workers, primarily on preventive measures kwa mikoa yote. Ndugu zangu, like any other country in the world, the pandemic hit our country at a time the health system wasn't resilient to handle it. Due to the pandemic, the essential health services has been jeopardized, including maternal and child health, especially immunization. Watu walikuwa wanaogopa kwenda kwenye vituo, mnakumbuka wote. Kwa huduma ya mama na mtoto, hasa chanjo, iliweza kuathirika. Na sio kwetu tu, ni dunia mzima. Na sasa tunaona madhara ya madhara ya mlipuko wa ugonjwa wa uviko 19. Lakini pia we see that we had also shortage of resources. We all know the human, material and financial. But even with the available financial resources, at some point, procurement and timely delivery of supplies couldn't work due to prolonged shipping and little in the country of production. Hata kule ambako walikuwa nazalisha, viwanda vilifungwa kutokana na ugonjwa wa uviko 19. Ladies and gentlemen, we are in an unprecedented period of imaging infectious diseases threatening human health and sustainable development significantly. The global response to COVID-19 pandemic has shown us that to be successful, the world requires every country to value humanity, and to some extent, the WHO have shown the uniting the nations toward a common goal to end the pandemic, and that together we can stand for humanity and well-being regardless of our economic status. The pandemic has also exposed some weaknesses in the existing global health security frameworks to contain the spread. It has exposed inequalities among countries, especially when it comes to vaccine. Nakumbuka chanjo zilivyoanza kutolewa, kila nchi zilianza kutaka chanjo kwa ajili ya wananchi wake. Hasa zile zenye uchumi mkubwa ndo uliona ndo ambazo zilikuwa na access, na hili jambo likawa linapigiwa kelele sana kwamba lazima kuwe na usawa katika access zile chanjo. But also we have seen injustices and mistrust among nations of the world. Coronavirus pandemic is arguably the worst pandemic the world has seen in 100 years. In addition to the confusion emanating from the impact of pandemic of COVID-19, its impact has gone beyond human health, affecting all sorts of life, with a severe impact on economies, affecting social sectors, tourism, livelihood, and generally throwing the global economy and health security into turmoil. COVID-19 has left the most vulnerable groups into exposed. These groups include those in poor physical health, the unemployed with least access to financing, communities with poor quality housing, social isolated vulnerable groups, especially those from poor countries already struggling with poor, low quality of life even before the pandemic. Distinguished participants, we all understand, it is understandably that people are tired of hearing about COVID-19, including myself. Tumechoka kusikia COVID, au sio? Situingia mwaka wa 3 sasa. Toka 2020 COVID, ukienda ku corona, oye, corona. Sasa mpaka kuna watoto wanaitwa corona. Kuna maduka yanaitwa corona. Yani, you know what? It's because of fatigue from the pandemic, which has taken over 2 years. Now we are heading to the 3rd year. And even some of them believe that the pandemic has gone. And this is not true. The reality is that the pandemic is still not over. It is still exists. The good news is that the virus can be contained, and it is our responsibility to ensure that it is contained, and it has been proven so. People need to adjust to this new reality as a normal, but should remain vigilant and aware that COVID-19 still exists, and therefore take precautionary measures to avoid contracting and spreading the disease from day to day. Although there is no way to ensure zero risk of catching COVID-19, taking precaution could reduce the risk of spread. As we continue to face this crisis and continue with our business, it is important that we listen to public health authorities and professionals and implement the advice and avoid unnecessary risk. We should be mindful of the fact that we are not just protecting ourselves, but also we have a moral duty to protect and support those who may not be so lucky to retreat into a safe space at home, away from transmission of the virus. My friends, these are the people that my legacy and other service providers must continue to support with the services to ensure that they stay safe. These are the communities that you as the stakeholders must reach out and provide services including vaccination, facility for hand washing, dissemination of right information on preventive measure to halt transmission of the virus, and as much as possible to provide livelihood support intervention to mitigate the impact of the pandemic. The government is aware of the work of the NGOs, my legacy, in fighting against COVID-19, in area of vaccine rollout, supply of hygiene kits, community sensitization, and information dissemination, and some areas, case management, support, and so much more. Protecting and promoting human health cannot be a matter of Ministry of Health alone. It takes a whole of society approach. When health is at risk, everything is at risk. This is the essence. My legacy and the others are taking steps to build the capacity of different actors to engage with the government in addressing challenges of COVID-19. Kwa tunaomba mtusaidie wadau ambao mko humu ndani kupitia hii my legacy. Tunatakiwa ikifika mahali tukijitathmini, hivi sisi tulichangia kiasi gani watu wetu, kuwalinda watu wetu katika afua ya kutoa chanjo. Na nyinyi ni watu wa muhimu. Nashukuru kuna maafisa maendeleo wa jamii, ustawi wa jamii, watendaji, huko ndo kwenye wananchi. So NGOs and the private sectors and individuals have a role in the community mitigation strategies to minimize morbidity, mortality, and the socio-economic impact of COVID-19. The government will continue to provide an enabling environment for partners to cooperate. Hiyo ndo lazima niseme. Yaani sisi kama serikali tuko willing, tuko radhi, tuko tayari kufanya kazi na sekta binafsi inayoitwa leo masaa 24 siku 7 za wiki, mwezi, mwaka na huko mbele. Na tunajua mnafanya kazi kwa kufuata miongozo ambayo inatolewa na serikali. Na tukiimarisha sekta binafsi huko, faida zake ni nyingi. Kidole kimoja kivunji chao. I request you to go out there and work diligently in a manner that will help to bring hope, relief and comfort to the vulnerable, particularly women, children, persons with disabilities, elderly and those living in a marginalized community. With this brief remark, now it is my humble pleasure to declare that this training is officially opened. Thank you very much for your attention. God bless you.